While choosing the right gym is important, it's also important to know what you're doing when you get there.
Yeah, or that you're doing the right stuff.
Yeah.
And knowing the type of workout that's right for you as well, so that you can have a safe workout, is something that you really have to keep in mind. Dr. Sevilla is joining us now this morning with reasons why consulting your doctor before starting that workout is important. You hear it all the time, don't do this without asking your doctor. Does anybody really come to you and ask, hey, you know, I'm thinking of joining a gym. What do you think? What should I do? Or should I do this or that? Do they really ask you?
Actually, I get a lot of questions about that, especially if there's family history of things like heart disease and cholesterol problems and diabetes. So I do get those questions a lot, especially this time of year.
So what types of rules then do you set up for them? Because I guess it would depend on everybody and their ages and so on. What types of rules do you set up for them?
Well, what I tell them is to start slow. Usually in January, people just get on the bandwagon and just go. But there are some medical problems to really look out for. A lot of people call high blood pressure or hypertension the silent killer, and people usually don't have symptoms from that. So if you don't go to your doctor, go to the pharmacy, go to the store, and get your blood pressure checked out. Because if it's higher than 120/80, I would see your doctor, because that could really hamper your exercise program.
And one of the things that you really have to look out for is your diet to start off with. What are some easy things that people out there, no matter what condition they have, should start doing in their diet?
I get that question a lot. You're like, well, is this diet the right diet? I saw this on TV, I saw this in the paper. What I tell people is just to start simple, start slow. Everybody can have more fruits and vegetables in their diet.
Right.
And it's cheap, it's easy. Even just one fruit or vegetable in each meal, which in most people is one, and just start slow and easy like that.
Right. So being, a lot of people go for the all-protein idea and that kind of thing. Sometimes that's too much to do.
Everything in moderation is okay.
And when we talk about age, because I asked you this too, I mean, like your average 20 or 25-year-old is probably not going to think twice before they go and hit the gym hard. Is there a certain age where you should definitely be thinking more? I mean, what is it, 40? Is it 45? They always say, oh,
or should
today's
the younger
40
ones,
is that, should
to
the
the
younger ones be asking as well? I mean, is there an age?
And everybody hears about, and they see that childhood obesity is a big problem, especially in kids and teenagers. So there's really no age to really kind of say, oh, it should be this age that you should be looking at things. Also, people should really look at their family history and see if there are medical problems. That's another good reason to see your doctor.
Those weight loss pills too. Now's a big time where you're going to see a lot of advertisements for it, the easy way out. What do you need to consider if you're thinking of taking one of these weight loss pills? What else should you be looking for and be aware of?
Well, and any type of thing that you see in the pharmacy, it does say to check with your doctor first, especially if there are some underlying health problems and things. Just be very careful with those, because some of them have a lot of side effects. People have heard of some of the side effects of some of these nutrition or things that especially the teenagers take in the gym, that has caused some health problems and some deaths sometimes as well.
So you have to be careful.
Yes.
Yeah, and write everything down that you're taking and that type of thing too. Also for a workout program, people say, oh, I'm drinking lots of water. Really? How much water, if you're going to start something different and you're exercising in the gym 3 or 4 times a week, should you be aware of changing those types of habits, and how much should you change it?
Well, I mean, just increasing the amount of fluid intake that you have, more than you have now. I don't have a definite type of number and things, but just more than what you have now when you're at the gym, before and after. Keep yourself well hydrated.
It's important.
All right, Dr. Michael Sevilla, thank you. Does that include coffee? That's all I want to know.
Actually, that's a great question. Not really, huh?
Everything in moderation.
Everything in moderation. All right. Thank you, Dr. Sevilla. We appreciate it.